I'm Dr. Mills, and I'm a psychiatrist with my own private practice called Freedom Psychiatry, because mental health is freedom. My practice focuses on achieving mental wellness through medications, nutrition, and lifestyle changes. I will be posting videos on a regular basis that answer common mental health questions. Today, we're talking about intense emotions and difficulties becoming pregnant and fertility treatments.
Dr. Mills, here's a question. I'm already stressed out. How might getting fertility treatments affect my mental health?
It's very common to feel stressed while you're having difficulty becoming pregnant and receiving fertility treatments because of the stigma, because of the frequent medical interventions and doctor visits, and the high treatment costs that you may be experiencing. The stigma is one of the hardest things to overcome because in our society, we don't actually talk about getting fertility treatments or having difficulties becoming pregnant. Really, it can make someone feel isolated and alone. But I want to reassure you that you are not alone. It is so common for people to be having problems becoming pregnant and receiving infertility treatments and having some stress that deal with that. So you're not alone in there. I encourage you to reach out to family, friends, or a mental health professional to help alleviate some of the burden. If simply speaking with family and friends isn't enough to help alleviate your stress, or you're having symptoms of depression and anxiety, you can review my previous videos to remind yourself of what those symptoms are. Please speak to a psychiatrist or feel free to give me a call for your 15-minute free consultation to help you with your symptoms.
Thank you, Dr. Mills. That's really helpful. I have another question here. I'm taking some fertility medicines and hormones to help get pregnant. I'm worried I might be feeling especially anxious because of the medications. Can you help?
Yeah, I can. And reproductive psychiatrists can help you with some of those feelings. Fertility treatment medications can sometimes cause symptoms like insomnia, anxiety, mood swings, those sorts of things. With those, sometimes you need a little assistance because they're just a bit overwhelming, really. So, what we as psychiatrists do is we talk to you about it, and then if we find that the symptoms are so severe that it's actually interfering your daily life, then we look into helping you short term with some medications. For example, let's say the insomnia is really bad for you and you've been having problems sleeping at night to the point where you try to get up in the morning early to go to work, but you can't even get up in the morning early. You're getting late to work and then you can't focus during the day. That is something that would be an example of a symptom that is causing you difficulty in your daily tasks. So, if you were speaking with me, I would definitely help you out with some medication to help you sleep temporarily while you're on this fertility treatment.
Excellent. That's really helpful. Dr. Mills, I have one more question. Are there mental health issues that might make it more difficult to get pregnant? For example, if I'm depressed, say, will it be more difficult for me to get pregnant?
Well, this one's a little tricky. There is an association between eating disorders such as anorexia and bulimia with decreased fertility. But if we're talking about depression and anxiety, the evidence isn't quite clear in the research. One study of 58 women actually noted that women who had depression symptoms were twice as likely to have difficulties becoming pregnant. But if you actually look through the article, the researchers didn't control for factors like cigarette smoking, alcohol use, body mass index, those sorts of things. So, with the absence of good statistics and such a small number of women in the study, it's really impossible for us to tell at this point.
Thank you very much, Dr. Mills. You've been very helpful.
Thank you so much. I really appreciate all these questions that have been coming in. If you would like me to be your reproductive psychiatrist, please go to my website at freedom-psychiatry.com. Click on the book appointment button and schedule your 15-minute consultation with me, Dr. Mills. Thank you so much for listening. Have a great week. And remember, mental health is freedom.